We did a VDI conversion throughout our clinical environment initially, and we went to a little bit over 9,000 endpoints throughout the hospitals. And we were running from Horizon Client from the Windows 7 client environment. And we deal with the relicensing, purchasing new licenses for upgrades in the Microsoft world. And now with the new build issues, we look for an easier solution to manage long term. So IGEL came in, and we had a short window, very short, to do the proof of concept. They signed the contract and they said, we want you to start deploying 3 weeks later. So we built out the whole back-end environment very quickly, and then did a lot of customized stuff to make it fit into our environment and make our deployment much smoother. You know, we have our own back-end solution. We scripted everything so when the image can cut over the computers to IGEL, it automatically puts them in the right buckets within the system, so that the desktop folks in the field didn't have to go into the console and move everything manually. And this made it to where we can convert a device from putting a USB in there and booting it and being an IGEL device to 10 minutes. And so we rolled through our environment, started in July when the contract was signed, building everything out, doing the pilots to December 30th. We had one day short of meeting our deadline. We completed our rollout in the hospitals. And that's our success to it. I mean, we can massage the desktop, the IGEL device, so it looks like the Windows environment. Our internal dev created its own single sign-on to launch Horizon Client into VDI to get the SSO. So we have a lot of built-in talent that made it seamless, and the end users didn't see a difference. We had like almost 0 tickets as we deployed into the environment, so it's been a great success. We have 7,500 devices already converted to IGEL. Our future plans, as we migrate other clinical areas, we'll convert those to IGEL also once they go to VDI. Our next really big target is going to be hitting our admin users, our regular users, and then also our offsite users that are going to do the coding. We'll be rolling out IGEL to them so we can manage them through the internet gateway. In our environment, we do have thin clients, wise thin clients we converted to IGEL from the Windows embedded, which reduced our costs in the long run. But we also converted existing hardware that was already there, and much of it was older hardware. You know, it converts quickly, takes a little longer to boot, but once it's up, the end user sees no default to the experience. The experience is still really high quality, and we get to extend the use of our hardware longer. For our executives, we got the CIO and one of the VPs over our area we converted laptops for them right now, and with IGEL on them, and they're using them to carry to meetings. And this is kind of a pilot to what we'll be doing throughout the environment. When we first do our rollouts, we haven't seen a whole lot of issues, very few impact calls. To help with the issues in the field, we give the service desk read access or access into the console so they can get to the web client of the UMS console so they can do a reboot and things like that on their devices without having actually go to the field support to go out and handle the solution. When we went through doing our IGEL rollout to the environment and converted the users over, they didn't notice the difference from going from our Windows environment to an IGEL device, getting to the Horizon Client into VDI. Our experience working with Alchemy to do the IGEL project has been really a wonderful experience. The seamless solution for us to purchase the license and get it going. The exciting things working with IGEL is they have great customer support. They've done great support on getting this product up and running quickly in our environment, because we had really not a whole big window to do a lot of development and continue to offer solutions when we ask questions.